Finding out I was pregnant was terrifying. For reasons I don't want to talk about, this was not at all a time in my life I could manage having a baby. Luckily, I found out about the clinic when I was 5 weeks along, and that was early enough to have a medical abortion.
The Alberta Medical Abortion Clinic offers virtual and in-person care to women who are facing an unexpected pregnancy. We're unique in that women in rural and remote areas have equal access to services as do women in urban centers. Patients may be contacting us because they've had contraceptive failure. They may be contacting us because they couldn't afford contraception. And unfortunately, some individuals may be calling us because they've experienced sexual assault.
My patients don't always have access. They don't always have the ability to tell people what their concern is with their health. And one of the things that I have noticed in this area is that there is a gap when it comes to reproductive rights and women's health care. So while working with the online Alberta Abortion Clinic, it allows me to close that gap for a lot of reasons. It provides safety for the patients, it provides harm reduction for the ones that need it, and it provides a service which is healthcare.
I know we're in the 21st century, but we still find, lots of women fall in the cracks. They don't have proper access to many public health services that women in urban areas have access to. So being able to access a virtual service like the Alberta Clinic provides is an asset.
The patients who I see in my clinic who end up going to the online abortion clinic have expressed to me that they felt they were safe in their decisions, that they were well informed, and that they don't need to necessarily think that they were doing something wrong, which unfortunately with misinformation is abundant when it comes to reproductive rights and women's health.
The process was handled with so much care. The doctor was amazing. She explained everything about an early abortion and walked me through the entire process.
Traditional clinics, though they are very helpful and that they can provide other services, when it comes to medical abortion, a virtual online clinic really is a most efficient, accessible option for a lot of patients. Mifepristone and misoprostol are effective medications that do not cause harm to the person taking them. These are medications that have been proven to do the job that they are supposed to do.
Some of the challenges in implementing this initiative was securing enough stock of the medication and carry at all times, which will be accessible to any patient who needs it. The second challenge would have been for rural areas in Alberta, rural women living in those areas accessing such services, and that is being tackled by the mail-out pharmacy license, being able to ship out and provide virtual care for those women.
We had to find pharmacies who were willing to dispense the medication for the patients. And we had to find ways to offer confidential services to some patients. We've been able to cut a typical wait time from 2 weeks down to 2 days.
Virtually, you can book an appointment right away and be able to see by the physician. So quick access and accessibility would be the main two things that I think is the most important.
Patients can remain in their own home, surrounded by their support network, which is so important during a difficult time.
I really appreciate being part of this initiative, and I'm honored that we get to deal with a clinic that has a focus on women's health and women's reproductive health. It bettered the service provided to Albertans, and that's what we're all about as pharmacists, is be able to serve all Albertans the same and allow them to have access to safe and effective medications, to be able to take good care of themselves and their reproductive health system. It empowers women across Alberta, the province, to access the services that they need in a timely manner, in a safe, respective, judgment-free manner.
When women are able to access healthcare in a timely manner, their entire health is optimized. They're able to remain at work. The health of their family is improved. There's less disruption in their home life. And the patient, her family, and the entire community wins.
Being able to have this done allows me to be a better mother to my 3 children. So I'm really grateful to the clinic.
My hope in the future is that we don't provide this rigid system where some people are helped and some people aren't. but that everyone gets the care that they need.
It's been incredibly rewarding to help women in times of distress. And every day I'm reminded of how important these services are.